Hi, I'm Patty.
And I'm Gina.
And we wrote the book on imperfection.
Literally.
And this is our podcast, inspired by the book, Shut Up About Your Perfect Kid.
The Imperfection Connection. It's our way of inviting people to let go of who they think they should be.
And love themselves for who they are and were always meant to be.
Sing it, sister.
Good afternoon, Gina.
Good afternoon, Patty. How are you today?
I'm well, thank you. And yourself?
I am wonderful, Patty. What's not to love? We're back in the studio, and you know, the studio is my happy place.
We do have fun here.
It is.
We do
it
have fun.
is my happy.
Sans having to look at yourself
Exactly.
or myself.
Exactly. That's why I say it's my happy place until Matt sends us the footage. No reflection on Matt. He does a phenomenal job. But I have to look at what I look like. Mm-hmm. And one thing that is very apparent is I need to brush my hair. I do, but for some reason, just the frizz here in South Carolina.
Absolutely.
Going from,
I used Petey the dog's metal comb to get through this. Only because
you have fleas?
I can't find a rake that's small enough to comb my hair.
Well, today I really, in an effort to tame my hair, I use sexy hair. So I hope that we don't have to change the rating on the podcast.
You get us into trouble.
But anyway, it is really hard to see that. But I think we're all about honesty and being imperfect. And people have, people are probably wondering is in this age of AI, how do we know that Patty and Gina are real and not bots? Well, how many bots do you see with messy hair?
That's true. That's very true.
So we are here to say we are one.
You're authentic.
And I would offer that if we do look put together on any occasion, I would start to question our authenticity. But I did say
go ahead. I know.
Go ahead.
No.
You.
People volunteer saying,
right,
these two really need help.
Yeah, like how lawyers take on pro bono work and maybe some hairdressers, stylists.
I walked into a store the other day to just get some different makeup. Yeah. And I was honest with her. I said, what do you recommend for
someone
women
who thinks she looks like a hag on TV?
Exactly. She looked at me like, oh, you're beyond help. Oh. And that's how I felt. And she called
think you're
somebody
making
over.
Assumptions.
No, well, what did Maya Angelou say? It's not what they say. Yeah. It's not what they do. It's how they make you feel. And she made me feel like I was beyond repair. So she called in the reinforcements.
Really?
And a very nice woman came over and assisted me.
Wow. Mm-hmm. Did she say sorry, we don't have any products for you?
No, but she just gave me this.
But Patty, you rag on yourself, but you look very young for your age. I mean, I bet 90% of the people watching this don't even realize you're 105. But anyway, I know we're going to go into our little spiel and shtick about our week and all that, but do you want the numbers?
Absolutely. That's why I'm here.
We're all about sharing our success, and we continue to be on a upward plane.
An upward trajectory.
That's what I meant, not a plane. Okay. We're not in a plane. But if we were, we'd be at takeoff, not so much landing.
That's good because we don't want to crash.
And thus far, we haven't crashed, so that's good. All right, so you may recall in our last episode, what was our last episode about? Oh, Mom. It was about Mom. We reported that we went from 70, I guess, they all call it, all these.
I thought you said 400.
No. I'm going back from where it all began. So the first episode was
our humble roots,
our humble roots, as opposed to these gray ones. Anyway, so we went from 70, and then the next episode 2, we went up to 400. Now
all our episodes
we're on a lot of channels, and they all have different ways of measuring. Like YouTube measures
that's
views,
our excuse, and we're sticking to it.
Podbean measures downloads. So I just add them all together. Okay. Whatever. So, do you care to guess where we're at today? I know Matt's on the edge of his seat.
So it's based on
downloads, views, plays, all of that.
500, or is that
higher?
Really?
You could never go on The Price is Right.
No,
it would stink. All right, keep going.
7?
Higher.
No way. Not 1,000.
No, Patty.
Okay.
Come on.
I know. Wishful thinking.
824.
Wow. So
But we doubled.
doubled.
And we're our math people. We
Wow.
doubled. I mean, 400,
That's-
800. I'm no math expert, but that's doubling.
That is a very good sign.
It is a good sign. It is. And I notice people that are starting to leave comments that we don't necessarily know.
That's wonderful.
You know, we haven't gotten any hate mail yet, probably because our mail isn't
still early
working.
in the game.
And we haven't got any requests to be canceled, which is great. And we haven't been deplatformed yet.
Very good. And we're in May sweeps.
We're in May sweep. So I would say that people are listening, Patty. Although there is no way to track how many of those are my views. But you know what I saw, which was really interesting, is it's not just people are coming to YouTube to watch it, they're staying engaged. You know, so they're like, you know,
because we're so riveting.
like, apparently we must be, Patty.
Okay.
Either that or they go make a sandwich and forget that it's on.
True. Yeah.
Anyway, so that's my report.
Oh, excellent.
So, yeah.
Oh, okay. Well, I think one of the things at least that I wanted to share was how much pressure it is to be on a podcast. Not just for the appearance
It
sake.
is a grind.
But it truly is. And not just because we're based out of a coffee shop.
Right.
It is very difficult in that, and I'm just going to say, I might have to boycott you or go on a Gina diet.
Why?
Because the other night I couldn't sleep because I thought, I have nothing to talk about.
Really?
Nothing. I work at home, so unless I'm, engaged in a conversation with the UPS
There's
guy.
always something to talk about, Patty.
Well, but see, before I would talk to you, at boot camp,
So
maybe 3 times a
so
week.
maybe we should just not talk.
Well, that's what I'm thinking is like, I want to take a Gina hiatus.
Wow.
And not because there's just nothing.
And I've learned from watching the podcast that I dominate the podcast. If one were to break down the hours, it's probably like if we did an hour and 4 minutes last week, I probably did an hour on my own. And that's something that I really want to work on. I think when I'm always afraid that we'll lose the attention of our audience because I'm in marketing and you have to get engagement. And so I'm always thinking about the next thought and whatever. And I am not comfortable with pregnant pauses. I wasn't really comfortable being pregnant. So why would I like pregnant pauses?
Okay.
But pregnant pauses. And so I try to fill things in when it's silent. And in fact, one of my friends, Donna Ward, said that, Gina, silence
is golden.
She just said, silence isn't always uncomfortable. So in watching that, it's sort of like, it is kind of a wake-up call. And I think a lot of it is one of my biggest problems. And we'll unpack this in future episodes. I'll try not to talk about them as much. Is that I'm also I struggle with staying in the present.
Okay.
Okay. And I think some of that is self-employment.
Mm-hmm.
Your jobs are constantly, as a writer, jobs come in, just comes out, deadlines. I think some of it was my kids, or on Katie in particular, was always on her own schedule and slow to move. And we had to keep deadlines and, get to school and all that. So I kind of learned to do everything. And so I realized that yesterday, nature always gives us lessons, as my therapist Andrea always tells me. And yesterday when I was on the golf course, I saw a bird, a Nahinga bird, big bird here down in South Carolina, and he had a fish in his beak that he had speared, and I watched him swallow that whole fish without chewing, and I thought, that's kind of how I eat. So anyway, I'm going to work on that, and I don't want to just say that I'm going to work on not talking too much, and I know I'm talking too much as I tell you this. But it's going to be a process.
Yes. Well, boycotting you or going on a Gina hiatus will be difficult in some ways because I think the greatest challenge is we had mentioned in our last episode that we will be traveling to Massachusetts.
Yes.
And we are going by car.
Yes.
And should we elect to drive straight through, that's a 20-hour drive.
Right.
So talk about trying to fill content.
Right. We have to talk.
We do split the driving.
You drive.
I drive. It's about a 20-hour car ride driving straight through. I drive about 18 hours. Gina has 2 hours.
Right. Well, because I get distracted, and I'm not that. I'm a much better passenger.
Well, and you're kind of like
we solve crimes. We listen to true crime broadcasts, so it's not like I'm sitting there doing nothing.
Right. But you are a bit of a driving diva.
Yes.
I will only drive during daylight hours. I will not drive if there's any sort of precipitation.
No backing up. I don't like reverse.
So,
I had a couple of accidents in reverse. It's not my best gear. I think that it'll give us time to reflect. Perhaps we could come up with some strategies for how I can curb some of my talking. And I remember, when my kids were first diagnosed with learning challenges, they were put on individual education plans, or IEPs as is known in the strip. So I told you, I like that because it sets a goal, an IEP has a goal, and then it has how you will achieve it, and then how you will measure it.
Sure.
So I said to you last night, Patty, I think I need an IEP, which you called a
IPP, Individualized Podcast Plan.
Right. And so we have one. And
yes,
we have one for me, and I believe it was something like, we'll show it, but I think it was like an 8 out of 10 opportunities, Gina will shut up. No, it wouldn't be that
That was
high.
subtle.
It had to be like 2 out of 10 because we could never set that goal. And then some of the cues you would give me would be to go like this, or, sleeping. I know I talk a lot, but I don't find myself particularly dull.
No, I don't find you dull either.
But I want to work on that. I do. I want to work on my listening skills. So I'm not coming out here perfect. It's a work in progress.
That's true. And even though we have a visual for your IPP, I'm not sitting here in judgment and saying that there aren't things that I need to work on.
What do you need to work
It was
on?
just when you asked the request, it was rather late last night, and I just said, well, I had hoped to get to bed early so that I would have less bags under my eyes.
Right. So not only are you doing more of the driving, you're doing more of the podcast, way more of the podcast.
But I wasn't, that wasn't
and I'm going to announce this right now. It's a little premature, but, I've consulted with the rest of the staff, and we've decided to award Patty Podcast Employee of the Month.
Thank you.
You're welcome. Well, you have. You've been editing with Matt and just doing all kinds of little videos and yeah.
But there are things that I need to work on because I believe that someone, we'll call her Tina, had mentioned that when I tell a story, I give too many details.
That's from Dad.
Okay.
Dad used to say your sister gives a lot.
We'll
of
call
details.
him.
But in
Nad.
my defense, Mom used to say your sister mumbles and slouches about me. So, she was talking trash about me, and I know I need to work on my mumbling. My friend Flo told me that when I get into an emotional part, my voice drops even lower.
Okay.
I can't help it.
So the bottom line is we both have things to work on.
We do, and we'll work with them. We'll grow with you, audience. And so today we have a very special guest. We have 2 guests today.
2.
Now, the last time we pulled this 2-guest thing, it was us.
Oh, right.
Right? But no, it's not us.
Are we going to have them back?
I really like those gals.
Yeah, I did too.
Patty, they were fun. No, actually, they were pretty serious that day. So we have 2 guests that, continue our line of health and wellness because we're always looking for ways to live our lives healthier.
Mm-hmm.
Right?
Yes, we are. Always looking for alternative ways, just to let you know that there's options out there.
Right. So we have, do we tell them who our guests are, or do we wait until we go to the commercial break and then have them come back and just spring it on them?
Yeah, because I think that we want them to stay in the room with this. So I think that we tease it.
Right.
Just saying that, yes, we are going to be discussing with our 2 guests.
Right.
Health and wellness.
Yep.
And then bring them in.
Great. I'm looking forward to that. So I'm just going to eat some Wicked Pop while we go to a commercial.
Okay.
And we'll be back with our guests. Thank you.
Thank you. Looking to make a splash with your next vacation? To gather, laugh, and learn with special friends? who'll last a lifetime? Get on board with Buddy Cruise, an annual conference at sea that brings together special needs families around the globe to learn, network, and participate in activities for all. Space is still available for Buddy Cruise 2026, sailing aboard Royal Caribbean's Symphony of the Seas from September 20th to the 26th. To learn more, visit 1-877-BDY-CRUZ or visit buddycruise.org. That number again is 1-877-BDY-CRUZ or visit buddycruise.org. Looking for the perfect speaker? I mean, imperfect speakers. For your next conference, event, fundraiser, book club, or knitting circle?
Why not us, the Shut Up Sisters?
As authors of the best-selling parenting book, Shut Up About Your Perfect Kid, we travel the country, speaking about the joys and challenges of raising children who don't meet society's ridiculous standard of perfection.
To learn more about bringing our message of joy and acceptance to your event, visit spedchildmass.org. That's SPED childmass.org or call 978-857-4566. That number again, 978-857-4566.
We're back. And as you notice, we have two very special guests today. And thank you, Matt, for accommodating us. Poor Matt, we're always like, well, we need stadium seating this week.
But you two should realize that we are forging podcast history here. We have never had so many guests in one place, in one session.
And probably now would be a good time to introduce these guests.
Oh, I thought they were just actors we hired.
I was just walking through the parking lot and somebody said, you want to come in? So here I am.
Scrubs on. We figured he looks smart. Let's
He's
get
a
him
doctor. I play one on TV.
Yes.
So we're going to start with Jeanne McGuire. Jeanne is our guest producer who brought our lovely guest here today.
Right.
And that would be Dr. Grant Evans of Novo Regenerative Clinic.
Correct.
So let's begin. So I don't know if Jeanne warned you that we were going to give you some hard-hitting questions.
We don't want our guests to just like, you know.
You're not going to skate.
Yeah,
like
you're not
you
gonna-
come here,
you know.
we're going to make you think
I
really hard.
have not slept in days.
Okay.
Are you ready?
Yes.
You go first.
All right. So my first question to you, and I don't want you to answer right away. I want you to
Take
think
your
about
time.
it. So what is your favorite color?
It's always is and always has been green.
Green. Okay.
Very nice. Interesting.
Me too. Ding, ding.
Really?
Really?
Green.
Wow.
Mine is plaid, but that's, so.
Can I ask my question? Is my hair sticking up? Because every time I watch this podcast, it looks sticking up. Well, that was for Dr. Evans. He would tell the truth. Anyway, thank you for coming out to the
Yes,
podcast.
thank you both.
Yes.
Well, and thank you for having me, and Jeanne invited me because it's the subject we're going to be talking about is everybody's heard about, not a lot of people know about, including myself. A couple years ago, it was very new to me. I'm a chiropractor for over 30 years from Columbus, Ohio, down here. So the whole regenerative medicine thing is new everywhere, and of course, it was new to me. But I've kind of crash coursed it over the last couple of years, and we've had some exciting.
And we
results.
have a real live person who has done your therapy, Gina.
Yep.
Right.
So could you start by telling us what, because if I was on, say, a contestant on Jeopardy, I would not fare very well in the regenerative medicine
Nor would I.
category.
What is that?
What is it?
Regenerative medicine is basically restoring damaged, worn out tissues, muscles, tendons, and ligaments, and arthritic joints and so forth, back to normal through the use of mesenchymal stem cells.
That's how you say it.
Yes. Some
I was
people call it
practicing.
What does that mean?
mesenchymal. Mesenchymal is just a word that basically is related to connective tissue. It's muscle, tendon, ligament. So it's more or less the stem cells are derived from an area that's more connected tissue, which specifically is the umbilical cord.
Okay.
That's what we take is the umbilical cord cells. We call them mesenchymal stem cells. But
So how did you get into this, going from chiropractic care to
My son, who practiced with me for years up in Ohio, when I sold my practice, he moved with his wife to North Myrtle Beach, where his in-laws lived, and a couple of our grandkids, a couple of his kids. And he got involved with regenerative medicine, specifically stem cell injections, with a doctor up in North Myrtle Beach area. And for a couple of years was telling me, saying, Dad, you got to see these x-rays I'm looking at of degenerative joints that now are not somewhat non-degenerative. These patients up here that haven't golfed or played tennis or pickleball for a number of years because of degenerative joint, knees, hips, back. They're back playing back to normal, almost symptom-free. And I kept saying, you're kidding me. And then he came down. Then inadvertently, I met my partner, Dr. William Durrett, who is a licensed anesthesiologist, pain management doctor, whose main office is in Aiken, South Carolina. He had an office in the same facility we have at Moss Creek, where he treated his pain patients and did stem cell. Okay. I noticed the word regenerative medicine in his bio. He was looking for rental space and to move. And I said, are you doing stay? He said, oh my gosh, I've been doing it for over 9 years.
Wow.
Probably not too many other MDs that have been doing that much regenerative medicine stem cell work on the East Coast United States, let alone locally. So he and I hooked up, and I said, I'm very interested in this. And so I still practice chiropractic a day and a half a week, but they've blended together because I do, as Jeanne mentioned, we do the follow-up care. I don't do the injections. Dr. Durrett does.
Okay.
And then they see me for a series of follow-up care, which ironically most clinics around, there's very few around here, but around the country that do stem cell, most all of them do not do any follow-up care. They inject the knee, the hip, the back, and they wish you pay them. They wish you the best, and you're on your own. But we do some follow-up care.
What is that?
Crucial.
And I guess Jeanne could probably, speak to.
It's we use different therapies. We have an MLS laser. It's a fancy laser machine that helps to decrease swelling and inflammation following the procedure. It helps get good blood flow to there. We use different other therapies, ultrasound, some electrical muscle stim to use to reduce spasm, swelling, inflammation.
Yeah.
And then once they reach a certain point, then I tend to send them home with some stretch bands that everybody's kind of used to at a physical therapy place.
Sure.
And I show them exercises because oftentimes the degenerative joint that we've treated, they haven't used that for years. So all the muscles in that area are also very weak.
Right.
So once the joint feels better, you've got to strengthen that area. You just don't run out and start playing pickleball 5 days a week and expect the joint to be okay. So
you're in our wheelhouse. You're talking pain. You're talking degenerative, like
pickleball. So it comes from, the stem cells come from the umbilical cord. And how do you get the umbilical cord?
Our lab, which is called Regenerative Labs out of Florida, the hospital harvests these umbilical cord cells from consenting females after the birth of their child.
Okay.
19 to 26 years of age.
Okay.
C-section only. They don't do natural births. They don't want the cells going down the vaginal canal. So yeast infections, whatever may happen. But so the hospital harvests those. Our lab purchases them, and I know our lab said out of 10 vials of stem cells that we get, they get, and we purchase, only 5 to 6 out of 10 make it to us. The others are discarded due to maybe there's evidence of alcohol, drug usage in the cells. They don't look viable. They don't look strong.
So how are they coming to you? Are they like in those little lunch pails?
Freeze dried. They're frozen.
They're frozen.
Yeah.
They're frozen solid. As a matter of fact.
So they're in the umbilical cord form?
Well, there's the gooey.
We need pictures.
The gooey stuff after your children were born.
Yeah.
Took the umbilical cord. The gooey stuff in there is called Wharton's jelly.
I didn't know. Patty, remember that for Jeopardy.
Okay.
Yes. That would be a good one. Yes, you'd stump everybody. Dr. Wharton was a doctor. I think he's long gone. But inside that gooey are the stem cells of the mother. and those are taken. So two types of stem cells. One is the umbilical cord cells that we use. The other, which a lot of people have heard of, is called PRP, platelet-rich plasma.
Oh,
That's where we would draw your blood off.
yeah.
Patient we did this morning, we did her knee. She came from Beaufort. She's 75. She asked me about PRP and what would be like kind of the difference. I said platelet-rich plasma is when we would draw your blood, spin it down,
Right.
separate the red blood cells from the clear part, which is the plasma, draw the plasma off, which has some of, as I told the patient this morning, has some of her semi-worn out, tired old 75-year-old stem cells
Right.
in it, to re-inject back into her, as opposed to brand new, days old umbilical cord cells from a young 19 to 26-year-old
Right.
woman.
So I think I've met a lot of people who have, my husband had his knees replaced, but I've met a lot of people who have had that PRP, and some of them said it didn't help at all.
It tends, it's natural as opposed to multiple cortisone or,
Right.
prednisone injections, but it does have to be done once or twice a year. It's not permanent, and some patients get nothing out of it, and others have gotten success from it. But it's a temporary thing. It's much cheaper than umbilical cord stem cells that we do.
Yeah.
Okay.
Jeannie, can you tell
I was
us your
just going to ask you a question. Yeah.
Well, I had a few sports injuries. One, a pickleball injury. I fell and hurt my hip, and I had to have hip surgery. And it was so extensive, I didn't want to go through that again.
Sure.
So I started to investigate alternative therapies. I did look into PRP, but I figured the stem cell looked like it was a lot more powerful. Because you're using, I'm 63, 63-year-old cells, like he said. I'd rather have younger cells and help me regenerate. And the recovery for rotator cuff, which I have now, is like 6 months.
Yeah,
So
my
I
husband had
figured,
that.
let me just try this, and I didn't want to go through it again. So I went to a few places. I did my homework. I looked it up, and I posted something on our local website to see if anybody had stem cells.
Yeah.
And a woman responded, and she told me all about Novo Regenerist. And I had gone to another place, and it was literally 3 times more money.
Wow.
And not that you were the cheapest, but
Hey, who can we talk to about that?
you were the low bidder. So I went, and he's so charismatic.
No, I'm not finding
Told
it.
me,
Yeah.
told me, so much about it the first day, and I was like, all right, well, he couldn't fit me in that day. I was like, if you can just fit me in, anything you can do, call me. I'll just be down here in 20 minutes. So I went to Marshall's shopping after, just to kill time, and the phone rang. He said, we can fit you in. Somebody canceled their appointment. I said, I'll be right there. I drove up, and I have to say, it's not a quick fix. It's not something that's going to be happening in a week, but I can sleep at night. I couldn't sleep at night. My shoulder was killing me. A lot of pain. And twice a week I go, and they do this ultrasound, like TENS machine.
Yep.
Yeah.
And it takes away the inflammation. Oh, I should mention, when I was sent home, I'm sent home with this red light pad. It vibrates, or it just gives you, it's this big. It covers a large area. I put that on every night on my shoulder before I go to bed.
It's called a DNA Vibe. It's a 4-mode therapy device with just infrared, near infrared, which is 2 different wavelengths. They do different things. I can't remember which one does what. There's a micro vibration, and then there's a magnetic component. Magnets offset pain.
Right.
The old magnetic bracelets and so forth. Yeah.
It works. There's something to it.
And the president of that company told us, and it's an award-winning device. They've won all these awards for it for some reason. But he said, if you have a patient that's committed to getting stem cell, have them do it 2 or 3 days before, because it causes DNA excitation. It jazzes the joint up that's about to receive the stem cells. So when the stem cells go in, it's already fired up, ready. It works better, faster, quicker. And then we have them do it once or twice a day for a couple weeks, half an hour treatment. Very comfortable.
It works. It works. It helps.
So it's the injection. Like, how long is the actual?
Does it hurt,
procedure?
Jeannie?
So what?
Does it hurt?
The injection?
Yeah.
No, not at all. No.
She's tough.
Dr. Red, who he's done thousands and thousands and thousands of injections. We numb the area first with a spray, and then we put a little, maybe some lidocaine or something to numb the whole area, like a dentist, office, so to speak. Like the patient this morning, we did her knee, and I said, "Okay, you did great. We're done." And she went, "Oh my, I
That was fast.
didn't even know." We also do our injections. Well, back up. We do our consultations under what's called video fluoroscopy. That's a motion X-ray machine. So imagine laying on a table. We bring the tube over. Normally, you can take an X-ray and it's a still plain film. Sure. We can move.
It's like a live
around,
X-ray.
and and the patient's looking at the screen, and we're pointing out. It's not as diagnostically valuable as a X-ray, but what it's better at is it shows inflammation. So we do a knee joint, the areas of inflammation show up dark. And so when we do the injection, Dr. Dredd is doing the injection under the video fluoroscopy. So he's looking at the screen, putting the needle in the exact.
That's great.
Because that's the difference, right?
Nobody uses video fluoroscopy because it's a very expensive X-ray machine, but we have access to it. So,
but it's more accurate.
Does the healthcare companies recognize stem cell? Will they pay for it?
You mean insurance companies?
Insurance companies, that's what I mean.
yeah, here's where we'll get controversial.
Right, it always does.
Answer is no. Medicare covered stem cell treatment for about 3 years and stopped several years ago. People ask us why. Here's the controversial part. Bottom line, it's big pharma.
Yeah.
They want people to take drugs and do cortisone.
Yeah.
Sure.
Hospital lobbyists, they want people to get knee replacement and back surgery and hip replacement surgery. And
Well, and being a chiropractor too,
Right.
You were swimming against the tide.
oh, yeah,
Yeah.
sure, yeah.
And that just made me so sad because we come from a long line of people with bad backs and aches, and I had my back would lock up and I couldn't walk. I was in agony.
Yep, I've had.
And I went through, physical therapy. Nothing helped. And then I found a chiropractor, and I would literally barely walk in there. My dad practically had to carry me in. And I came out and I was walking erect and
Now,
and they
insurance
were paying.
coverage.
But we were paying, like when I went to a chiropractor.
Yeah, it was expensive.
You were
three
paying
times
out
a
of
week.
pocket 3 times
Yeah.
a week.
Oh, insurance covers chiropractic now. Medicare.
Now they
Right,
do.
but
Yes.
you had to.
But back in the day,
but
they
your
didn't.
industry had
Yeah.
to fight the insurance.
I'm glad that I haven't been to a chiropractor.
Way back when, before, maybe I wasn't born, maybe I was a junior, who knows. But chiropractic, when it first got started, I practiced in Ohio for 30 years. There was old-time chiropractors in the town. They would frequently be arrested for practicing medicine without a license.
Wow, really?
Stories I heard, they'd be arrested. They'd be thrown into Little County Jail down the street. All the patients would head to the jail protesting.
On the
They'd
windows.
say, "We'll let you go, but if you promise not to practice again," and he'd say, "Okay." And the next day, he was right back in his office doing the same thing. So, because when I used to talk to young chiropractors that said, "Oh, insurance, deductibles are going up, they don't pay us so much," I went, "Oh my heavens, insurance covers us now. You think things are bad now? How about when you were arrested for practicing without a license?"
Yeah.
Those days are long gone. And I practiced, when I sold my practice, chiropractic, Dr. Bob Gavin, he's a big orthopedic surgeon, great orthopedic surgeon. Friend of mine from Long Cove, where we belonged for years. He owned the Sport and Spine Institute at Moss Creek. Well, he said, "We want a chiropractor in our office."
Great.
I said, "Well, good luck." He said, "We want you." I said, "I just sold my practice. I'm not going to do this again." Well, he talked me into it, and I only practice a day and a half a week, and my wife does some of my therapy. And when I was way young up in Ohio, I had the 60, 70 patient a day practice. So
Wow.
I couldn't do that now at my age, mentally or physically.
Yeah. I bet it's a big physical toll.
Oh,
on you.
yeah.
I know. It just makes me sad that, there's a combination of sometimes traditional and.
Well, the good news, you'd never see a chiropractor like now, me in a medical facility with orthopedic surgeons.
Yeah.
We get along fine now.
Yeah.
They understand our education. We stay in our lanes, and it's worked out very well. But
because if everybody was on the same page trying to get the patient better,
yeah,
you know.
well, there's different, like Jeannie mentioned she was looking for alternative care, and
Right.
chiropractic is considered alternative medicine.
Sure.
Anything out of the mainline, medical field.
Right.
Yeah, and what it drives you crazy because you watch like all these commercials about pharmaceuticals, and it's like whatever it is, it's like we always laugh like may cause death.
Yeah.
Right. Yeah.
And it's like so you read, a lot of these. I have once again I didn't want to talk about it, but I have trigeminal neuralgia. Here we go again, as the neuralgia turns, and they gave me meds that took away the pain.
It's treating symptoms.
And right, but it's like, but I don't know the efficacy if it's going to continue to work for me, and I don't know what it's doing to my body, and so I want to look at
Now, one thing with trigeminal neuralgia is, I'm sure you've been told, is it can literally just disappear like that and never come back again.
Yeah, I'm praying for that.
As sometimes it comes on that way.
Right. And then I've met people who have it and say that I talked to a woman maybe last week, and she was like, oh, she found out I had it, and she says, I am so sorry. It is the worst thing. There is no cure. There is, surgery can leave you drooling. I'm like, okay, I got to go now.
Yeah.
That was pleasing. But, back to the stem cell patients, one thing that when we talk to them, literally everybody has been through the procedures leading to stem cell as number one, I call it lifestyle modification.
Yeah.
I quit playing pickleball,
Right.
can't golf. We had one gentleman, we did both his knees, lives in Moss Creek. He doesn't play any sports. He's a widower. He said, I just want to walk my dog 2-3 times a day. And he was in last week he sees me now for his neck for chiropractic. And he said he's walking over 12,000 steps a day.
That's
Wow.
awesome.
And we did both his knees at the same time.
That's
Yeah.
great.
And but lifestyle modification, then it leads to usually bracing, back brace and knee support, whatever.
Yeah.
Then they get into the physical therapy. I love physical therapists. I don't want anybody watching this physical therapist take this wrong, but I've never had a patient back related, arthritic joint related, that went to physical therapy 3 times a week, sometimes for quite a while. They would mostly all say the same thing. I'm no worse. I'm no better. I feel exactly the same. And they're usually asking me, do you think I should quit going? And of course, I tell them, I don't want to tell you to quit going, but I would tell you what I would do if I was you. The stretching they showed you, do that because that's good. But then it's all of a sudden into the cortisones, the anti-inflammatory pain medications over a period of time. I, for some reason, did not realize that cortisone injections, every time anybody gets one, the relief period becomes less and less
That's
and
what
less
happened to my husband.
until eventually they're non-effective.
And it deteriorates your tendons. I've had
Yeah.
many of them for the shoulder.
And then it leads to you're a candidate for a total joint replacement surgery.
So if
Yeah.
if this works, I mean, I know Jeannie's early into the process, but does it last?
These cells, when they're injected, and they're in a 2 cc vial, there's 75 to 80 million stem cells. I counted them last night. I was up,
Really?
was up all night. This is what we're told. I don't know who counts these.
Right.
But anyways, once they're injected, the first thing that they do is they reduce swelling and inflammation.
Yeah.
That alone is going to decrease the pain in that joint because the pain receptors are firing off from a sprained ankle hurts because of the swelling triggers the pain receptors. So it decreases that. So frequently patients come in and go, I still have a lot of stiffness, tightness, but the pain levels have been greatly reduced. Then over a period of time, they will start to break up pre-existing scar tissue and adhesions that have formed in the joint. I tore my knee up severely, just one knee 30 years ago, tore the ACL ligament and 2 cartilages.
So painful.
And I've had stiffness every day for 30 years. Pain? No, I don't want to get dramatic. Stiffness, tightness, achiness, wear knee support when I golfed, couldn't bend down or read a putt on a green. I got stem cell in my knee 2 years ago, and it feels as normal as my right knee. I can bend down, get up.
Let's talk to us. How's the handicap? Has it dropped?
Yeah.
Yeah, I'm a
That's another whole problem, right?
3-4 handicap.
Oh, okay. All right. Yeah, good.
So because my putting is improved, like I guess because
Is it true that you doctors always play golf on Wednesdays?
Yeah.
chiropractors are Tuesdays and Thursdays because we treat patients Monday, Wednesday, Fridays.
Okay. Good
So,
to know.
Yeah. So
So I got to ask you this. So this all sounds great. It's amazing. I mean, it sounds like, it's effective. It helps people. But for our people watching at home, if insurance isn't covering this, like how do they afford it?
Yeah.
to answer your other quick question about how long does it last?
Yeah.
It's designed to be, permanent. Now that's going to depend on the age of the patient, how degenerative the joint is. Are they morbidly obese? Are they diabetic? Are they on a lot of other medications that interfere? A lot of factors. I tell my Sun City patients that come in, I go, if your goal is to get back playing in a Sun City flag football team, this may not work. Right. Golf for sure, walking, tennis most likely, pickleball, how many times a week? 2, probably 5. Let's keep our fingers crossed. But Dr. Durrett will say, when patients ask him frequently, he said, I have patients in Aiken that I treated 8-9 years ago that are still symptom free and doing their thing.
That's great.
That is great.
So I don't, honestly, I probably don't know enough about it to say, oh yeah, this is a permanent thing. That's what we're after.
Right. I'm just thinking if someone says, they have it and they get relief and, or, they're desperate. They're desperate. They don't want to keep going under the knife. They don't want to people want to do something and it's probably an investment. Is it, how do I know it's going to work?
Right.
Yeah.
Are there financing options for people? Like how?
What we have is our only option. We have Care Credit. Yeah. That's a medical credit card thing.
Yeah.
It's a pain. It's wonderful. We've used it several times, but it's kind of a. Did we use that with you? No. Okay. Okay.
Duh.
Oh, that's right. You just gave us your welfare check. Yes. But it's like a medical credit card that you can apply, and then they pay us, and then they collect from the patient. But it's so much paperwork. We don't want to use it.
It just makes me sad that these therapies are
so acupuncture is expensive.
All of it.
Yeah.
No.
The one plan we have is
that way.
We have patients who will pay us half up front and then the other half on their credit card over 3, 4, 5 months.
Yeah.
We get their credit card information on file just every 30 days, bill. But
you can use a credit card and you don't get a 3% charge, which everybody does that 3% now.
Yeah. I mean, we prefer, a check, but the credit card, but, they're so. Did you want to know pricing? Is that what you're getting at a little bit?
No, just options. I mean, we you knew we had Josh on from Restore, and we just wanted, for people to know that there's other options available to them. But, we want to, obviously, it's a very individualized decision for people to make, up for them to do their own research, but just want them to, to be aware that there are other things out there.
I watched your podcast with Josh. It was very interesting. They're doing a lot of neat things at Restore.
You didn't find us interesting?
Are you guys in on that? I did not see you two on that. But especially the
Do we have an eject button in our
especially the cryotherapy.
Yes, which she did.
Yeah, my sister's done that, and she said
it's great.
For reducing inflammation immediately.
So what can we do as citizens? I was going to launch a campaign to run so I would allow people to use their medical doctors, but I went to a holistic doctor, and every time I go, he sells me supplements that make me feel really good. And, an appointment, and it's, I'm like $600-800 into the appointment, and insurance doesn't pay for that. What can we do as citizens to get these companies to recognize, they're recognizing
the legislative thing?
Yeah, that's what I say. It's fighting City Hall because you've got such huge, with Big Pharma and, of course, hospital lobbyists and the Medical Association. But it's getting better, but slowly. My personal opinion is I think Big Pharma, in a number of years, I don't know, 3, 4, 5 years, realize regenerative medicine is here to stay. It works. Yeah. It's effective. People are demanding it. Somebody eventually Big Pharma is going to stand up and go, why are we fighting this when we can let's try to control it? take it over.
Let's
I
work
learned
together.
what I learned recently, some good news, and this was prominent Boston hospitals, that we know this woman that does Reiki, and she said that the doctors were referring some of their patients to her. I'm like, that's a good sign.
Yeah. As the older doctors that are set in their ways, so to speak, kind of literally die off, and the new ones are new ones are. There's a huge studies going on with stem cell regenerative medicine and major medical. Jacksonville. What's the in
Mayo?
Minnesota? Mayo's doing a huge study on regenerative medicine stem cell.
Good.
So once these articles get published, your orthopedic surgeons have a convenient tendency to say it's very promising stem cell therapy, but there's just not enough out there yet.
Yeah.
Studies.
Yeah.
There are a ton of studies out there. They're not looking for them because they're not doing it.
Right.
But they will. Eventually, everything's going to come together. So
Yeah.
That's great.
Wow.
we'll be all old or assisted care facilities or in wheelchairs. But
Yeah.
Right.
You know, Patty and I were talking about, I think it was last week or the week before, that we didn't really like science or pay attention, and we didn't like the science fair. I don't know if you two like the science fair. You must have loved it, Dr. Evans. But now this is fascinating.
It is.
Jeannie knows a
Dr.
lot.
Burnett just told me today when he was 10, he loves to build models. He built a model of a body, and you could see all the organs
my
inside.
partner, Dr. Dredd,
And he said, I think that's why I became a doctor.
Really?
Yeah.
Oh.
We didn't do
I remember
anything
those
like that.
statues. You could see through them on all the organs through the plastic. And
Jeannie's like my go-to in our community when I have something. Jeannie knows, and like
She's wicked smart. It's like we like to say, wicked smart.
she researches, she knows stuff, she shares her experiences and all that.
Yeah.
You know, I think it takes a certain person to try new things. I've
Right.
talked to a lot of people like, oh, no, I wouldn't go to a chiropractor,
Right.
as if it was
Right.
something crazy.
Yeah.
I went to a chiropractor 35 years ago. I had acupuncture 30 years ago.
Yeah.
I always would try something, anything but the knife, anything but a drug. If you don't
when I
have to.
graduated from chiropractic school in Chicago, I think 10 or 12% of the population saw a chiropractor. Now it's probably up in the 80s.
Yeah.
I used to have them come in years ago when I first, and they said, well, my neighbor said I ought to try to go to a chiropractor. And I go, okay,
Chiropractor.
first off, let's learn how to say it.
Right.
And then we'll learn what it is I do. But anyway, so
And it must be a very, I know you're not as into it as you were and you've reduced the time, but it must be a very gratifying, you're a healer.
Yeah.
When you think you walk in and you can't walk, and then
I've
you
had
know.
patients over the years up in Ohio, especially because I had a bit heavy blue collar practice up there in a suburb of Columbus. And I don't know how many times I would have a pickup truck pull up. A couple guys get out, put the back out. They slide their friend out. He can't walk. They bring him in, you know. And
it's awful.
and it was funny because I already knew the answer. I would always say, "What the heck did you do?" Nothing. I got up this morning.
Yeah.
I bent over to pick a
Sneeze.
newspaper up, and it was like someone shoved the knife in my back, went into spasm. Then I would say, okay, what have you done physically in the last 3, 4, 5, 6 weeks? Nothing. I said, yes, you did. Think. And I always remember one patient's wife said, honey, you helped our daughter move out of her apartment. You were lifting furniture and boxes. Well, that was 3 weeks ago. It didn't hurt then. I go, no, but that's when you did it. And then middle of February, Ohio, freezing cold. You didn't stretch out. You got up and bent over to pick, and your brain said, oh my gosh, he's picking a couch up again. And like a Charlie horse, it just locked on you. But I could send that guy out, walking out, though.
That's awesome.
Not to go bowling,
Yeah.
okay,
Right.
but pain-free. And then in 2 weeks, he's kind of back. That's a patient that's going to keep. And my philosophy my whole life has always been, unlike some chiropractors, once I get you fixed, come in once a month for preventative care.
Yeah.
You need in sooner, call me. If not, see you in a month.
Well, because the back affects everything.
What's that?
Oh, yeah.
The back affects everything.
Everything. Yeah.
Her, when she was getting married, our father who art in heaven, he
Well, yeah.
he had a really bad sciatica, and we didn't think he was going to be able to walk her down the aisle. And
in my wedding pictures, you can't see them, but he was on crutches.
and they had a motorhome parked outside the reception so that he
Him to
could
go
lie
lay
down.
Yeah.
And it was sad because it was like,
the most joyous day, his
Did he have
firstborn.
surgery then? Or?
No,
No,
he
it
went
just
to the
eventually-
chiropractor
he went-
eventually.
Because I was first introduced to chiropractic care through my dad, because he started going. Because we all, like Gina said, our whole family, mom really didn't, but we all had lower back issues. And because my dad started going to one and I could see the results, I started going. So that was at least 30 plus years ago.
Yeah.
Sciatica is like trigeminal neuralgia of the back.
Oh, he was-
any nerve pain.
And our dad was like, that generation, they didn't complain or anything like that. And, you could just see how
Yeah.
My
he was
biggest-
gray in your pictures.
My biggest problem in the first 10 years of practice was convincing patients that couldn't hardly walk, come in, or maybe migraine headaches, who knows, in the upper. And I get them fixed, and they go, I said, you're doing great. Let's just do once a month. They go, let's just leave it alone. Fathers used to say, if it ain't broke, don't fix it.
Right.
If it starts to bother me, I'll call you. And I go, well, here's the deal. I believe you, but here's human nature. You will not call me till you're dying. And then we're going to start over. And I'm warning you, and this happened a lot. You come back in again and we're starting over. We're going to have a long chat because you playing doctor apparently isn't working. And then usually when they come in, they go, I don't want to go through this anymore. Once a month, see you in a month.
Yeah.
And that was it. But
Well, that was great. I think that, that was really informative. And
Yeah.
well, one other last quick thing. The one thing that had the negative stigma with stem cells early on was a moral issue because a lot of people thought they were going to be using aborted fetuses.
Yeah.
Right.
And
I
no,
thought
we
that.
don't take fetal cells. They're umbilical cord, donated. So
so if I come in with my own umbilical cord, do I get a discount?
My mother
Do you have any
saved you to
umbilical
sit in
cords at
envelope.
home?
I'd say, how long have you had this? And by the way, too, by
Fossil.
we've done well, close to 150 patients the last 2 years. Our greatest
Is the knee.
response are the knees.
Yeah.
They respond the quickest.
And that's the worst surgery. Isn't that the worst joint surgery?
Shoulder.
I don't know. Oh, is it? My husband
Shoulder
did that one.
replacement is very involved, more than hip. But the knee's a simple joint. All it does is straighten and bend. So it responds much quicker than maybe a shoulder or a hip.
Yeah.
But our knee, our success is mid 90%.
Wow.
Measured on 50% improvement in pain levels as well as functionality, how they're able to use it.
This is good to know.
But our knees are
Even if it's bone on bone? Because people ask that all the time.
two 96-year-old men in the last year.
96?
They're both 97 now because I use one of them when patients want to call somebody to see how that went and they're thinking about it. We use John. I said, John, I told him you're 96. And he goes, Dr. Evans, I'm 97. I tease him. I go, John, 96, 97. We're parting hairs here, okay? But he could barely walk when he came in, bone on bone. Total knee replacement, but obviously you can't do that in 96. It's too dangerous. Anesthesia and things. So, and he said the cortisone, they won't even give him anymore because it doesn't work. He said, and he could barely walk on his just one knee. And we put stem cell in, and 3 weeks later, he came back in to see me, and he's walking
He's
with a walking across the parking lot. And he inadvertently sent us 3 women at his church in. They thought he got a knee replacement because he's walking normal at church.
Yeah.
And he said, no, I got stem cell. And so they came in, and
Wow.
yeah, it was great. So
Yeah, we meet a lot of people where we live that have double knees.
everybody down here
Yeah.
is older. Everybody has degenerative joints.
Yeah.
What I'm doing with stem cell would not work where I lived up north. First off, my patients were 40 to 60.
Right.
Here they're 65 to 120.
We're hopefully we'll live that long.
Yes. So
Well, thank you so much, Dr.
Yeah,
Hayes.
it's very
Thank you
informative.
for having
Well,
us
we
on.
invite you to stay though for the last.
Yes, we
segment
we read the news, just a couple of news stories.
when are we paid?
Oh, okay.
We're not there yet, but we are going to send you with one of our sponsors is Wicked Popcorn, and we're going to send you home with a bag of Wicked.
There we go. There we go.
Because we were out of Ronco
You're on the
toasters.
golf course. You're a little hungry. You want something healthy.
I'm going to head home right now and have a glass of wine and eat some popcorn.
There you go.
Watching golf. On time.
I know.
All right. So, all right. Well, so we're going to break for a commercial and come back.
Okay.
Hey, Pat, you know how I like to snack?
Oh, I do. I got that gene too.
And you know how much I love popcorn.
Why, I love popcorn too.
But here's the thing. Some popcorn is loaded with saturated fat and sodium. And as Mom used to say, all that sodium won't do you any favors.
And some of the, quote, healthy popcorn I've tried, it tastes like cardboard. Not that I've eaten cardboard or anything, although I heard it's low in calories.
Well, Patty, I have to tell you, I found one that's, as we like to say in Boston, wicked good.
Really? Do tell.
It's called, wait for it, Patty, Wicked Pop, and it's made with just 3 simple ingredients.
3, you say?
3, whole grain corn, extra virgin olive oil, and Cape Cod sea salt flakes. That's it.
Okay, now you've got my attention. Where do I get it?
Easy. Just go to wickedpop.com or find it at select Boston area stores.
One more time for our distracted listeners.
I'm sorry, Patty, did you say something? Oh yeah, it's wickedpop.com. I'm ordering some for us right now.
Me too. All right, we're back. So you two ready to hear some news stories?
See how smart you are now,
Okay.
Dr. Evans.
All right. Alabama woman, 65, shot and killed husband, 69, because he was annoying, prosecutors say. She reportedly revealed that her husband kept coming into her room and irritating her, so she grabbed a handgun and shot him to death.
Oh my goodness.
Did she get prosecuted?
Yes.
Oh.
Like, your spouse annoys you. Like, you can't hit him with a broom. Not that, as
I
Gina's
was-
advocate,
I was-
violence is not the answer. Use a broom or something. Like,
Yeah.
You know, I was with that story. I could relate to some of it until she took out the gun. and killed
yeah,
him.
like
Yeah.
that's to me. Just me. I think it's a little extreme.
How old was she?
She was 65.
So she
Wonder
can't
what
blame
he's-
PMS.
What did he say wrong? I wonder. That's
I
that
don't
wrong.
know. It didn't offer any details.
Some husbands can be annoying.
Yes.
Yeah. But we know you're not that kind of husband.
Oh, no.
And I know my husband isn't that kind of husband. Sound quite kidding. I'm just kidding.
And this story comes to us from Hartsville, South Carolina. And I know Gina's going to ask,
Close by.
where is that from here?
Oh, I
It is
my
northwest of Bluffton,
didn't
in
ask
about
that.
170 or 80 miles.
I did
but
not ask
know
that
you were
question.
going there.
There's a lake,
I'm
Lake
trying not to
Hartwell.
talk as
Is
much.
that it?
I don't know, it just says Hartsville, South
Oh,
Carolina.
Hartsville.
So this isn't very recent. However, in 2021, now, all right, I will preface this by saying that we've done several dumb criminal stories. To me, this one takes the cake.
Okay.
Okay, in 2021, a man attempted to rob a bank, though through the drive-through pneumatic tube system. He pulled up to the bank as if he were making a deposit, but instead sent a robbery note through the tube demanding money. According to reports, the note demanded money from all of the drawers and included a threat. The man stayed there waiting for the tube to come back with the money. But instead, the teller called 911, and before the man could drive away, police arrived and arrested him.
Do you know why he wasn't effective? Because he should have put the gun through the tube.
I thought you were saying put the gun in there. Like there's
He never said he had a weapon. It's like, what did he think?
Could be
okay,
mentally
you're
ill.
threatening me. I don't know.
If I'm a teller, I think I would have thought it was a joke and sent the note back and said, I just looked in all our drawers and you're out of luck. We don't have any money. Come back tomorrow.
It would be funny if he put his mask in there. You know,
I don't know.
used to use the president's masks.
Yeah.
Oh, yeah.
Like smiling COVID.
So if you have a goofy news story
or ideas for guests.
yes,
Or
yes.
questions for.
shoot us an email at oldbagmailbag@shutupabout.com.
And Dr. Evans, where can they find you? You guys have a website?
Yeah, our website is novoregenerative.com.
Great. We'll put that in our show notes. Do we have show notes?
Yeah, and our prep's right at Moss Creek.
Well, we are an international audience. Do you know we have a following now in Ireland? We're up to like 17 people now in Ireland.
I know.
Been in Ireland to golf.
And you guys are Italian.
Yeah.
I know. We're from Massachusetts. We'll get into this on the first part of the podcast, but we're from Massachusetts, where we spent the majority of our life, and we have like 6 followers
In Massachusetts or total?
in Massachusetts.
Oh.
Yeah. No. Now that we have you, we'll get to 7.
Yeah.
How long have you been doing this?
This is
Isn't that like 2 months?
2 months, Matt said.
Whose idea
Okay,
was
thank
it
you, Matt.
to go from writing the books to doing a live podcast?
It seems to be like podcasts are all like, it's a very saturated market, but we feel like, we go out and speak and audiences hire us to speak with our book, and we find that they always say to us, we loved your presentation. We would love to sit down and have a cup of coffee with you. Yeah. And so I don't drink coffee anymore. These are props. Yeah. Yeah. But yeah, so, and it's sort of like to get our message. We started in the special needs community, and that's really our hearts are with that. But it's like taking something that, your kids have challenges. Society thinks they're not good enough or they're not enough. And so we wanted to broaden it with the podcast to take it beyond that to, you have other areas of your life and you may need help or feel alone, feeling pain, chronic pain. Jeanne and I have bonded over chronic pain. So just offer support and then solutions.
I was golfing the other day, so we were talking about, I said, I would hate to be a young person in junior high now and have to live unless we got some major changes going on with this country and this world. What a tough place.
Yeah.
And I said, nobody, when I was growing up in Pittsburgh, where I was born and raised, nobody committed suicide. Nobody.
Well, maybe we didn't hear about
We smoked marijuana and got caught by our basketball coach and had to run extra laps.
Oh.
That was the worst.
Now it's all coming out about Dr. Evans. Dr. Evans, wow.
Okay.
So we should close it out, but thank you,
Thank you.
Jeannie. Thank you, Dr.
Dr. Evans.
For having us.
Appreciate it.
Thank you, Patty.
Thank you, Gina. Thank you, Matt.
Matt.
And we will get your parting gifts, your bag of
Yes,
popcorn
yes, you can.
before you leave.
It's the only reason I really came.
The information shared on the Imperfection Connection podcast is for informational, educational, and entertainment purposes only and is not intended as medical, psychological, legal, or professional advice. While we may discuss topics related to health, wellness, personal development, and life experiences, neither the hosts nor guests are providing professional advice or services unless explicitly stated. The views and opinions expressed by hosts and guests are their own and do not necessarily reflect those of any affiliated organizations. Listeners should not rely on any information presented in this podcast as a substitute for professional advice, diagnosis, or treatment. Always seek the guidance of a qualified healthcare provider, licensed professional, or other appropriate expert with any questions you may have regarding a medical condition, mental health concern, or other professional matter. Never disregard professional advice or delay seeking it because of something you have heard on this podcast. By listening to the Imperfection Connection podcast, you acknowledge and agree that the hosts, guests, and producers are not responsible for any outcomes or actions taken based on the information presented. Use of this podcast and its content is at your own risk.